Tonight at 5, breaking developments on the future of your health care. The Senate announcing major changes amid deep divisions. Good evening and thanks for joining us. I'm Wendy Ryan.
And I'm Jamison Euler. The Senate trying to win over skeptics.
Yeah, but tonight the revised health care bill is already facing resistance. ABC Action News anchor Paula Grown here with what it means for you.
All right, here's what we know so far tonight. We know that this bill does keep Medicaid cuts and it also allows for cheaper plans. And let me walk you through this. It also has more resources to fight the opioid epidemic, which obviously is very important to people in Florida because that's a big problem. Also, and it provides for more help for out-of-pocket costs, which will help combat some of those rising premiums. That's all on paper, but I went to a local business today, and the question there is, how is this going to affect them?
When the tunes are pumping, the guys in the garage are working. At Southern Tire Company on MacDill, elbow grease may get the job done, but it's honesty that's kept this South Tampa business going for 63 years.
You guys are kind of like doctors with cars. I mean, people come to this place and they don't know what's wrong with their car, kind of like going to a hospital, but there's a difference.
Exactly, because when you come to a place like this, I mean, you want to know what you're going to pay before you walk back in the door and pick your car up, not drop your car off and then we just tell you what the price is when you pick it up. I mean, that's not how business works. I mean, you don't do that to people.
But that's exactly what happens to most people when they go to the hospital. When do you pay? How much? Confusion remains at the heart of the healthcare crisis, even as today the Senate offered its latest version. The new bill providing roughly $70 billion in additional funds that states could use to make healthcare more affordable. It also lets insurers offer cheaper healthcare plans, and for the first time would allow people to use their health savings accounts to pay insurance premiums.
My daughter went to the hospital just a week ago, and it was a $400 copay, and we get the bill in the mail, and that's what you pay. I mean, can we get an estimate?
Hey, you got to laugh or you'll cry, right? Well, the Senate will start debating this bill next week, where there will likely be several more changes. And as it stands tonight, the Senate Majority Leader Mitch McConnell says he is not confident that he has the votes to pass it as it sits right now. But as they say in Washington, the sausage is still being made.